I'm Maria, and I'm here as a mother to share some tips on how to keep your mouth and your babies healthy. Let's start with good oral health while pregnant. It's safe and recommended to see a dentist for a cleaning and checkup before, during, and after pregnancy. Medi-Cal covers unlimited dental visits during pregnancy and for 12 months after you have your baby. This is important because pregnancy can cause changes in your mouth, like inflamed, sore, or bleeding gums and cavities. To keep your mouth healthy during pregnancy, you should brush at least twice a day for 2 minutes with a soft or medium bristled toothbrush with fluoridated toothpaste. Floss at least once a day. Use mouth rinse to kill germs and plaque. Avoid alcohol and tobacco products. Avoid sugary drinks like juice, soda, and sports drinks. Cut back on sugary snacks like cookies, candy, and pastries. And schedule regular checkups with a dentist. Some people worry about getting x-rays at the dentist when they're pregnant because of radiation. Don't worry, the American Dental Association reports that x-rays are safe at any stage of pregnancy when protective lead shields are used. So don't put off visiting a dentist during pregnancy. It's important to have regular checkups to keep you and your baby healthy and catch problems early. Next, let's talk about your new little one's oral health. As your child grows, keeping good oral health habits is important. Giving your baby a bottle to fall asleep can cause cavities because juice, milk, and formula contain sugar. The American Academy of Pediatrics suggests breastfeeding as the main source of nutrition for your baby for about 6 months. After 6 months, you may start introducing other foods. The American Academy of Pediatrics supports that breastfeeding can continue for as long as the mom and baby want. Formula feeding is an option when breastfeeding isn't possible. For infants, brushing after breastfeeding or bottle feeding is recommended. It's important to brush their mouth after they eat, especially along their gum lines. When teeth start to come in, brush your child's teeth at least twice a day with a pea-sized amount of fluoridated toothpaste and a soft bristled toothbrush. And floss to clean between their teeth. Bad habits for your baby's teeth include frequent thumb sucking and frequent use of pacifiers. It's also important not to share saliva with your child through toys, pacifiers, or food. Bacteria can easily spread through saliva and stay in a child's mouth, especially once teeth have appeared. To avoid this, try not to share utensils or food with your child. Kiss your baby on the lips. Put a dropped pacifier in your mouth to clean it, or wipe your baby's face with saliva. And most importantly, remember to schedule a dental visit for your child at age 1 or when the first tooth appears, whichever comes first. Don't have a dentist? It's important to find one to catch problems early and give you and your baby the care you need. Learn more about your Medi-Cal dental benefits and find a dentist by visiting smilecalifornia.org or calling 1-800-322-6384.